biggest advantage of bariatric surgery which we have seen is resolution of diabetes. In 1/3 of the patients, somehow, because of various mechanisms, when we operate the obese patients, the diabetes disappears next day.
Obesity is a lifestyle disease, but lifestyle is not the only reason. There are so many reasons we don't even know of why obesity and diabetes is increasing to the extent that we are seeing today.
Bariatric surgery is one treatment option for obesity. It is not for everyone. And bariatric surgery is also metabolic surgery. So it is being performed also for diabetics as well as obese.
All right, hi, welcome to Radio City. Usually अगर मैं वीडियो पे आती हूँ ना तो मेरे साथ कोई खास होते हैं, and this conversation is super special because जब मुझे पता चला था कि डॉक्टर प्रदीप चौबे का इंटरव्यू हो रहा है, I was so greedy. I said I have to do this. ये मेरा actually second मुलाकात है सर के साथ, and I think, sir, you know the way you answer, I just want to say before I make it an official video again, वो चीज़ें इतनी simple तरीके से समझ आ जाती हैं that it stays with you. Last time when I came, it's been some years, हमारा इंटरव्यू एक ऑपरेशन थिएटर में हुआ था. आज इस सुपर वाइब्रेंट रूम में है, सर के रूम में है, राइट हियर एट मैक्स हॉस्पिटल. डॉक्टर प्रदीप चौबे विद मी, चेयरमैन मैक्स इंस्टीट्यूट ऑफ लैप्रोस्कोपिक, एंडोस्कोपिक, बेरियाट्रिक सर्जरी एंड अलाइड सर्जिकल सर्जरीज. Sir, 45+ years of experience, some 20,000 surgeons been trained under him. It's such an honor to meet you again,
Thank you, Divya. It's always a pleasure. Always a pleasure to share viewpoints and also clear some doubts and some questions which are commonly asked. And sometimes there are a lot of myths surrounding the medical profession as such, and in general, I would say. So it's always better to give a little scientific background to it and more understanding from medical side how we feel that way, and needs a little alteration in thinking, and we always try to be positive in our expressions rather than looking at the nagging point of the issues.
Sir, but what do you eat? आप अभी सर्जरी करके सीधा इंटरव्यू पे बैठ गए. I thought sir आएंगे, हम चाय पियेंगे, पानी पियेंगे, and he's ready to roll. What keeps you going?
Well, I think your love and affection and passion for work, I think that is what is important. I see the smile on my patients and their families, and of course whom I meet like you. So it gives you energy. It's a good energy. Lasts longer than the artificial energies.
I think that is so true. अब उन questions की ओर बढ़ते हैं जिसके लिए मैं सर से मिली हूँ. A lot of these questions, of course, have been shared by you. Time and again हमें कई बार जब experts की तलाश के लिए आप लोग सवाल भेजते हो, हम कोशिश करते हैं उन्हें collate करके एक पेपर पे जो है मैं अपनी research करके ले आऊँ. Sir, obesity, I think last time when we met, it's been some years. मुझे लगता है इन सालों में cases भी बहुत बढ़ गए हैं. Obesity as a phenomena has gone up tremendously. A little about obesity, and sir, क्या obesity और diabetes साथ साथ आता है और?
Well, I think in especially I'm talking about the Asian population. All of us, we have this combination. Many times I start imagining that these are the two sides of the coin. The obesity and diabetes. At least in our subcontinent, almost about 67% documented. And maybe a little more than that undocumented. 67% of the patients who are diabetic are having obesity, in morbid obesity and super obesity, and that is what we call is a metabolic problem. And I'm sure it's a very common observation for all of us that the Indian obese persons, they are not obese in the upper body, not in this thing. Our obesity lies in the abdomen. So that is known as a metabolic obesity. So if the weight is more, and if the thighs are big, and if the hips are big, and this is big, it's not likely to produce diabetes. But if you are thin all over and abdomen is obese, which we very typically we see in Asians, that is metabolically active fat. There are two types of grossly saying fats. One fat is not really metabolically active, somewhere under the skin, and but some fats which are in the liver, which are in the intestine, which are in the other parts of the abdomen. That is metabolic heavy. And what is metabolic activity of a fat?
Yeah.
It captures the insulin. It occupies the insulin.
Right.
So when it occupies the insulin, less insulin is available, though there may be a normal production of insulin. But that insulin is wasted because the fat cells, they capture the insulin.
Right.
And that is not available for glucose metabolism or carbohydrate metabolism. So this is what is the metabolic activity of the fat which causes the problem. So I always prefer to call it as a diabesity, diabetes with obesity. And why it is important to use this word is that unless you treat obesity, then the diabetes can be treated. But if you just try to polish one side of a coin by giving a lot of medicine for diabetes and you don't take care of the weight, though that is a futile exercise. And that is the reason why a lot of our patients are not able to cope with diabetes and the control is very poor.
So थोड़ा सा वजन कंट्रोल करना है, थोड़ा वेट कंट्रोल करना है, इसलिए ज़रूरी है क्योंकि उसके साथ साथ और भी चीज़ें आ जाती है जिसमें डायबिटीज़ ऑफ कोर्स इज व्हाट वी ट्राइंग टू एक्सप्लेन. सर वैसे और प्रॉब्लम्स भी आ सकती हैं ओबेसिटी के साथ बिसाइड्स डायबिटीज?
Yeah. Diabetes is one of the commonest. Another is a sleep apnea, what we call as a obstructive sleep apnea, because there is a fat in the tongue, the fat in the throat. If you see these persons, they have a very, there is no neck for that matter. There is no neck. So all these things combined together narrows the respiratory lumen. Because it's all around. There's a neck, there's a pharynx where small, few grams of fat itself reduces, narrows the respiratory thing, and that's where they start snoring. And if X liter should go, X minus liter goes because of the narrow opening. And there is a carbon dioxide which accumulates, and the carbonic acid accumulates inside, and that causes daytime sleeping, drowsiness. So you must have heard a lot of people say, when I get up in the morning, I'm not alert, I'm drowsy. I'm not energetic. As one should be after 6-8 hours rest. So that is also one of the very initial cause. People don't realize that. But I'm sure some of our friends or colleagues you'll find while they are talking, sleep, they doze off or they just blink their eyes as if they are in trance, That is a lot of road accidents, car drivers, if they have a sleep apnea, they crash the car, And a lot of road accidents happen because of this. And everybody pays more attention to alcohol and drunk driving. That also is bad. But daytime sleeping because of obesity, because of obstructive sleep apnea is also as good as being drunk.
So वो जो ट्रांस है या वो जो स्टेट है जिसमें आप लेजीनेस है या आपकी एनर्जी बिल्कुल डाउन हो जाती है, इट्स प्रॉब्ली अलार्मिंग एंड यू शुड रियली बी चेकिंग कि प्रॉब्लम हो कहाँ से रही है एंड सी एन एक्सपर्ट. सर अगर ओबेसिटी से डील करने की बात आती है, ट्रीटमेंट के तरीके जिसका थोड़ा लॉन्ग टर्म इफेक्ट हो सके, इफ यू कैन टॉक अबाउट दैट.
वेल आई थिंक हियर ऑल्सो वन आई थिंक आई वुड लाइक टू ऐड इन मॉडर्न सोसाइटी another point. First, of course, is a strong genetic predisposition of obesity. That is important. We all understand. Second is the food intake that is there. Third, of course, we talk about exercise, how much physical activity you do. But fourth thing which not very much appreciated, not as much as I would like it to be appreciated, is the sleep pattern. So I think this is very important. In the modern society, I think most of the people, especially the young people, sleep very late, 3 o'clock, 4 o'clock, 5 o'clock in the morning. So why it is so? I think there are two hormones in the body. One is known as a ghrelin, which is an appetite hormone. So when you are awake, the ghrelin is secreted. And while you are sleeping, the leptin is secreted, which is a satiety hormone.
Right.
So More leptin, you feel full. More ghrelin, you feel hungry. So because you are keeping awake late night, your ghrelin secretions has not stopped.
Right.
You continue secreting ghrelin. That causes hunger. And then at odd hours, what is the only solution is the junk food.
Yeah, munching.
Munching. And that increases. And then after munching that much, you sleep, where your caloric requirement is 0 or minimal.
Yeah.
So the whole thing gets deposited as fat because that is not, you're not burning. But say, suppose you have a good breakfast and you are working for the whole day, whatever you must have had in the breakfast, you are using it. It's like you are filling the tank and letting the car stay in the garage.
Yeah.
Whereas you are filling the tank and driving the car and burning that fuel.
So when are you burning the fuel and आप कब खा रहे हो, कितना खा रहे हो और कब सो रहे हो, वो सारी चीज़ें बहुत इंपॉर्टेंट है. सर मुझे ऐसा लगता है हम ये चीज़ें बचपन से स्कूल की असेंबली से सुनते आते हैं एंड टिल द टाइम वी डोंट हिट दैट डेंजर पॉइंट ना हम लोग ये रियलाइज ही नहीं करते हैं. एंड मे बी सम पीपल डू रियलाइज एंड at that point of time bariatric surgery is probably the only option or maybe काफ़ी late हो जाता है. How does that operate now, sir?
Well, I said we should, in a way I say that bariatric surgery is the last resort.
Yeah.
It's compulsion. When you know that this obesity goes beyond a particular level, when we say with diabetes is 37.5 body mass index, if it goes beyond, then it becomes irreversible, you know. So then surgery is the best option. Like the heart surgery, you know, the heart bypass.
Yeah.
When the occlusion or the narrowing is 60, 70, 80%, 90%, you are left with no alternative but to bypass. Same way I say, bariatric surgery is a life-saving surgery, you know. Today, we will feel very bad and sad and disturbed if somebody loses life because of obesity.
Yes.
Because fortunately, we have bariatric surgery at that particular point, not at the beginning. The best thing is, please calculate your body mass index. Very simple, weight in kilograms divided by height in a square meter. You don't have to be a mathematician. Just put it, there are a lot of web, internet, it's available. Put your height and weight, it will give you a BMI. And you should keep on checking the BMI. In fact, I insist on a lot of schools that they always talk about the marks in the subject. But they should calculate the BMI also. Every year. If the BMI is increasing, they should warn the parents. And the parents should take it seriously and consult and discuss with the bariatric experts and obesity experts. So that is, I think, is very important. But yes, once you prevent that, then the battle is won.
So कब पहुंचना? I think, like sir said, bariatric should be the last resort. जब आपके पास कोई और option नहीं बचा है, maybe that is when the surgery should happen. Sir, can it really reverse obesity and diabetes?
Yeah. Well, I think, you know, bariatric surgery is considered as a life-saving surgery, like the heart bypass, as I said. So when there is no option available, see, with 120, 130 kilograms of weight, how much you can walk?
Yeah.
The heart will not give support. The lungs will not give support. The joints will not support you. So how long you can walk? So that becomes a physical limitation. And you should not let this surgery damage you. And bariatric surgery, another biggest advantage of bariatric surgery which we have seen is resolution of diabetes. In 1/3 of the patients, somehow, because of various mechanisms, when we operate the obese patients, the diabetes disappears next day.
Wow.
In 1/3 of the patients. And next 1/3, it disappears within 3 months. And in almost 92% of the patients, when they lose weight, the diabetes disappears.
पर इसका मतलब ये नहीं है कि अब आप बोलो अच्छा सर्जरी होगा तो सब कुछ अपने आप ठीक हो जाएगा. प्लीज एक्सरसाइज, लाइक सर सेड इन द बिगिनिंग, व्हाट यू ईटिंग, व्हेन यू स्लीपिंग एंड योर एक्सरसाइज इज वेरी क्रिटिकल. एंड ऑफ कोर्स अगर जरूरत पड़ती है, देयर आर एक्सपर्ट्स लाइक डॉक्टर चौबे टॉकिंग टू अस राइट नाउ. सर, एक सवाल जो आई थिंक बहुत सारे लोग ये इंटरव्यू देख के पूछना चाहेंगे, कितना रिस्की है अगर मैं सर्जरी लूँ? बिकॉज एवरीबडी जस्ट, वो फियर तो सबको होता है.
आई नो. सी, द सर्जरी word is again integrated with fear.
Yes.
And this fear is not today's fear, but it is a fear on the past.
Yes.
So now I think with a center like what we have in Max Institute, I think, these are super specialized vertical departments.
Right.
Where your anesthetists are separate, your operation theaters are separate, your instruments are separate. So I would say bariatric surgery, according to my understanding, in a center of excellence is absolutely safe, I would say.
Yeah.
In very, very rare circumstances, when the patient reaches us very late with a body mass index of 60, 70, which is 3 times than the normal BMI, those are the patients, or those patients who have multiple problems, heart attacks, this, that, and then they come for surgery. Then there may be certain risk involved. But by and large, in a good center, you should choose a proper center. There are, hundreds of centers across in the country. So you should go to the right person, the right center, and if you go there, is very safe. And another point is that bariatric surgery is the only surgery which not only reduces your weight, it causes improvement in diabetes, sleep apnea, joint problems, back problems. Not even this, in females, it increases the fertility. A lot of obesity causes infertility. It also increases your sense of well-being, your self-esteem. Your job opportunities increases.
Absolutely.
And family life becomes comfortable. You can visit all over the world for, without bothering much. So I think bariatric surgery is the only surgery in the medical world which not only gives one organ improvement, but it gives overall improvement, and not only the organ improvement, but psychosomatic improvement.
Absolutely.
Psychology.
Your psychology, your well-being, your presence, your confidence all goes up. हम लोग सबसे पहले जब weight control नहीं कर पाते हैं for whatever reason, सबसे पहले वो चीज़ हमारी confidence को तोड़ती है. तो पहले तो अपने पे check रखें. And then like I said, if there is a need, then where to be. सब कुछ question जो हर किसी के दिमाग में आते हैं, things like does a Mediclaim or insurance cover the bariatric surgery?
Well, I think in 2008, we presented white paper to the government of India, and since then I think in 2012 the CGHS and the central government have approved it. Lot of institutions have approved it, and now what in last 5 years most of the insurance companies are covering the management of obesity, because as a disease previously even they were taking it as a cosmetic surgery, which is not allowed. But this is classified as a life-saving operation, and hence most of the insurance companies are accepting it, with some reservations, of course, that you cannot insure yourself today and get bariatric surgery tomorrow. There must be, which you must follow. But I would say that even if it is not covered in your insurance policy, it will always be advisable that instead of waiting for that policy, you should not damage your body and suffer.
Absolutely.
And you might as well pay. And the biggest example which I always say is that when you go to buy a car, you just pay a small amount and then pay EMI. So these sort of loans are very easily available. Personal loans are available across. So it is worth being healthy rather than pay EMI like you pay for your car, for your home, because it's very important. If you're not healthy, nothing is going to make you happy.
Sir, and of course, what are the chances of people getting or gaining weight after the surgeries? Is there a chance that लोग वापस weight चढ़ा लें इसके बाद?
Well, I think there lies the role of the surgeons and the team. There are a lot of surgeries which are there. So we have to see what surgery suits the most for that particular person. And that decision can only be taken by a group of experts who have got surgeon, anesthetist, bariatric physician, diabetologist, we have nutritionist, we have anesthetist. They combine together. For example, in our institute, we have a bariatric board. So every patient is scrutinized in that board, and there is a written consent from the board that, okay, this is likely to be the best surgical option. So whatever is the best surgical option, if that is decided, that increases the success rate to a phenomenal level.
So there are a lot of people deciding, it's not just one person. But sir, कभी ऐसा होता है कि आप मना करते हो या कुछ cases हैं where you would say कि bariatric should, even the surgery is not meant for you, like cases.
Yeah. I mean, probably we feel very happy when a patient comes for the surgery mentally prepared and we say surgery is not good for you.
Yeah.
Or you don't qualified to be operated.
Yeah.
It's a lifetime decision. So we are very strict on that. A lot of our patients, they get disappointed that Doctor Sahab surgery kar dijiye, we are not able to do. But there are definite guidelines where the surgery is going to be helpful. It's not a cosmetic thing to do. So never force surgery to yourself. But when the experts advise you, then only you go in. And also the expert will tell you which surgery is going. There are a lot of surgeries. So experts will tell you what surgery is going to help you the most.
Sure, and now that you were talking about confidence, and it is life-changing at the end of the day, and you've changed lives for so many people. There are moments na jab aap बैठते हो आपको लगता है यार ये this was the day. There are moments that stay in your head. Yeah. Any that you think you can share with us? Something that...
Well, I think, we do a lot of gallbladder surgeries, hernia surgeries, hiatal hernia surgeries, complex surgeries. But the ultimate happiness for us is the bariatric surgery, because suddenly you are sitting in you are in the airport or you are in any social occasion and somebody will come and say, Doctor Sahab, do you recognize me? I say, we'll say no. They say, oh, you did a bariatric surgery 10 years back. And look, I mean, they become so good.
Yeah.
And that gives you a real happiness.
Yeah.
That he's not lost only 50, 60 kg, but he has gained the happiness out of that surgery.
Wow.
Which other surgeries don't provide. Say for gallbladder stone, problem ho raha hai, aapne gallbladder nikal diya, the person remains the same. Without the risk of the disease. Hernia aapne repair kar diya. But bariatric surgery changes the personality, changes the family life, changes his economics. It's amazing. Yeah. We never realized that there's so many advantages of bariatric surgery which these patients and their family goes through.
I'm very sure, sir. And I think bariatric सिर्फ आपका सिर्फ ऐसा नहीं है कि weight down हो गया, आपकी overall, like we've mentioned, overall life change हो जाती है. And once your confidence goes up, the world is your playground. So I would want you to just give a piece of advice, tips for everyone who's watching this. Obesity lifestyle disorder हो गया है, diabetes lifestyle disorder हो गया है. How do we fight it?
Well, I think more than fighting, probably I would say you have to be aware.
Yeah.
You have to be aware. And say today your BMI is 27.5, then you know that it's going to go up. Next year, you see it is going to 29.5.
Yeah.
So that is a time when you can hold it back, you can take actions. Of course, अगर आपको examination में pass है, होना है तो आपको पढ़ना तो पड़ेगा ही.
Yes.
So you have to make an effort. आप 4 बजे की जगह 3 बजे सोना शुरू कर दीजिए, 3 बजे की थोड़े समय बाद फिर 2 बजे सोना शुरू कर दीजिए. Then change that cycle. खाने के लिए भी आपका है कि you say, okay, I will not eat sweets for couple of weeks. क्योंकि ultimately diabetes होगी तो diabetes की 50 दवाई लेना पड़ेगी.
Yeah.
And 50 diet के restrictions होंगे. हार्ट अटैक होगा, हार्ट का प्रॉब्लम होगा तो ब्लड थिनर्स लेने पड़ेंगे, कोलेस्ट्रॉल की दवाई लेनी पड़ेगी. सो इंस्टेड ऑफ गोइंग इनटू दैट विशियस साइकिल, आई ऑलवेज से दैट रिवर्स दैट विशियस साइकिल. डोंट डू इट ओवरनाइट. आई ऑलवेज से हैव अ टारगेट, वेरी फिक्स टारगेट, 1-2 किलो पर मंथ. Don't have a big target of 10 kilograms every month, because even if you do it, it's not going to sustain. So have a small targets. Be careful where you're going wrong. Try to modify that. As I said, gradually modify it, That is the secret of success. And that is true in every field of life, your career, your education, your every field of life, So
So like they say, one step at a time, one day at a time, it probably means 1 kilo at a time. धीरे 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 चीजें बनती है. Do not look for remarkably big changes. So I host a show on radio. It's called Take It Easy. And before I let you go, what is your Take It Easy mantra? How do you take it easy in life?
No, I take it easy. I think the biggest thing is your happiness, and also passion for your work. Whatever you're working, if you're not working with passion, please change the profession. Right? It may be difficult, but yes, I think because सारी जिंदगी वही करना है.
Yes.
Don't force your children to go into a particular profession.
Yeah.
Let them evolve their likings and dislikings and work. That is one. And another thing which I said, you should always have some passion and some alternative hobbies. For example, I relax myself by looking at art, looking at various types of this thing. I may like to say participate in a horse race, something exciting, which whatever is exciting to you. Attend the various shows, dramas, comedies. So this is the way. Every time if you are doing what you are doing professionally is going to be boring, whatever, however passionate you may be.
Yes.
So declutter your point and don't get into too many things at a time, you know. Just concentrate on one. If you have an issue, you have a problem, solve that problem, then pick up another problem. 10 problems cannot be sorted in one day. If you try to sort them one by one, hopefully this should be a good message for that, you know.
शायद सर को याद नहीं होगा, but I would just want to give this as a closing this thing. When I met sir last time, मुझे याद है मेरे साथ आपको mention किया कि मैं 4 घंटे से ज़्यादा नहीं सोती. And remember you told me that बाकी सारी चीज़ें solve हो जाएंगी. तू अपनी नींद सुधार ले, improve your sleep. I've been sleeping for 7 hours. My rate from 4 hours has gone up to 7 hours.
Lovely.
At night. And I also do like Spanish classes additionally. So I have to declutter the mind. But little tips, इनको अगर आप follow करोगे life में तो आप बेहतर ज़िंदगी जी सकते हो. The whole idea is bring in those changes slow and we bring you the best any which way. Dr. Pradeep Chowbey, एक बार फिर से सर बात करने के लिए शुक्रिया. Radio City के साथ जुड़ने के लिए सर एक बार फिर से शुक्रिया.
Thank you. It's always a pleasure. Thank you so much.
Thank you so much for watching this. अगर बीच में से इंटरव्यू देखा है तो वापस शुरू से देखिए and share with people who might need it the most. And thank you for watching it again. ऑलराइट, अवेयरनेस की जब बात होती है तो मुझे लगता है कि सारी बातें मैं बता दूं तो बात कैसे होगी ना. तो इसीलिए वी नीड दी एक्सपर्ट्स एंड समटाइम्स आई थिंक ये कॉन्वर्सेशंस आपके बहुत सारे डाउट्स अपने बारे में या किसी क्लोज वन, किसी लव्ड वन के बारे में क्लियर कर सकता है. थिंग्स विच वी थिंक ना कि शायद और गूगल पे ढूंढते हैं. आई एम ब्रिंगिंग यू द बेस्ट एक्सपर्ट्स दैट आई कैन. Joining me now is Dr. Manish Baijal from the Max Hospital. We're talking about bariatric surgeries. Sir, President है Asia Pacific Society for Bariatric Surgeries के. And जो bariatric center है जहाँ सब कुछ शुरू हुआ, right here at the center, one of the founder members हैं. तो sir, thank you एक बारी फिर से हमारे साथ जुड़ने के लिए. You know, Max, especially for bariatric, obesity, diabetes, हमने जब इस मुद्दे पे या इन issues पे बात की है, Max has always been a partner to Radio City. So thank you.
Pleasure to be here.
So, you know, I've spoken to a lot of doctors today from your team as well. We've been talking about obesity. ये age bracket है जो working population का, and of course younger होता जा रहा है, say from 25 to 45. Why is obesity, diabetes coming up so much? I mean, gym में उतना ही भीड़ है. Everybody has been putting nice working out photos also on Instagram, but still इतने issues क्यों बढ़ गए हैं? Weight gain.
So obesity is a lifestyle disease. But lifestyle is not the only reason. There are so many reasons we don't even know of why obesity and diabetes is increasing to the extent that we are seeing today. So if you see people working hard on their health, if you see 80% of them, they are not working hard on their health. That's one. Number two, it's extremely challenging for the younger population today. They're spending more time at work. The work hours have become long. You speak to any patient who walks into our clinic, a young patient, when we talk about that they should be, you know, spending so much time on their health, they said time nahi hai. So that's another thing. They are looking at shortcuts for weight loss. Bariatric surgery is not a shortcut.
आई थिंक दैट्स द की वर्ड. और बार बार यही बोला गया है कि वो एक लास्ट सोल्यूशन होता है जब आपके ऊपर कुछ और काम नहीं कर रहा एंड यूर एट अ पॉइंट वेयर लिविंग इज बिकमिंग डिफिकल्ट. बेरियाट्रिक कम्स इन एज अ सेवियर. सो प्लीज वर्क आउट, प्लीज ईट वेल. So the problems that come with obesity, we've spoken about like diabetes, we understand. और क्या problems हैं जो हमें हो सकते हैं और हम realize भी नहीं करते?
I'll talk a little science about obesity. Obesity is a chronic inflammatory state. That is the understanding today. Yeah. Inflammation it's basically a trauma to tissues, to cells. So whenever there is inflammation, it starts affecting your organs. Okay, so when you have a chronic inflammatory state in obesity, it affects other organs by this means of inflammation. So one of the things that you develop is hypertension, blood pressure, diabetes. These two are the common ones. Every other person who walks in with obesity also has sleep apnea. Now this used to be a disease which was underdiagnosed. Yeah. We never spoke about it, we never worked on it. But sleep apnea is a very, very common disease and which has extremely harmful effects in the long run. There are certain cancers. So more than 10 cancers are associated with obesity today. The common ones are breast cancer, endometrial cancer, colonic cancer. Again, because of this chronic inflammatory state, there are certain changes which take place at the cellular level and that leads to these cancers. So every possible disease in our body is associated with obesity today.
So when we, and you know, of all these diseases, when we talk about diabetes, is it true that a diabetic person would be obese? I mean, there are myths, or maybe there are the questions that I got. Kya is zaruri hai that a person who's diabetic would be obese and vice versa?
No, it's not true. You will find lots of severely obese population coming to you with a weight of 150, 160 kgs and not having diabetes. But on the other side, almost 50 to 60% of the patients who come in with obesity also has diabetes. So if you look at the other side, if you're obese, you have almost 40% higher chances of developing diabetes as compared to a lean person.
Sir, and then, you know, a lot of people will also believe that हम अभी weight loss करा लेंगे, bariatric होगा. A lot of disorders can also be, you know, stopped or reversed. मुझे वापस अगर weight चढ़ गया तो?
You see, weight loss is something, especially after bariatric surgery. This is a decision that you will take once you have decided you are going to change your lifestyle.
Yeah.
It's not a magic. You have to change your lifestyle. Bariatric surgery has the advantage to take you to a place where medical means cannot take you. You've tried all possible means of weight loss. You are not losing weight. You are still severely obese. You have developed diseases. You are a candidate for surgery. You will have surgery. You will reach a stage where you won't have reached. You've lost good amount of weight. If you stop following a good lifestyle, then, like all of us, you will put on weight. Today, if we put on weight, we make sure in the next few weeks, we try and lose that weight.
Yeah.
So that's the same responsibility which would be with you after bariatric surgery.
सबसे बड़ी बात वही, आई थिंक सर ने जो चीज़ बोली थी कि टाइम नहीं है वाली जो हमारी चीज़ है ना, वी रियली नीड टू फिगर आउट हम टाइम अपने लिए कैसे निकाले सो दैट थिंग्स स्टे अंडर कंट्रोल. सर व्हाट आर दोज सिचुएशंस वेयर यू आल्सो से कि अच्छा नहीं, यू डू नॉट नीड बेरियाट्रिक, लाइक देयर आर केसेस वेयर यू रिफ्यूज कि नहीं करनी आपकी सर्जरी?
Yes, of course. There are patients, number one, who do not qualify for bariatric surgery. All they need is 8-10 kgs of weight loss. Their body mass index is 27, 28. They can work hard and lose that weight. They are not candidates for bariatric surgery. Then there are patients who are severely obese who do not want to make changes. So people who have lots of alcohol. So patient says, I'm not going to stop having alcohol. We'll say we'll not operate.
Wow.
Very heavy smokers. Patients who are heavy smokers, whenever they undergo any kind of gastrointestinal surgery like bariatric surgery, they have chances of developing ulceration. So you have to leave smoking, you know, but this is all about healthy lifestyle.
Yeah.
You have a healthy lifestyle, everything will flow with you. You do not want to change, we will not be able to help you.
So maybe, you know, a few tips from you for people who are probably now borderline obese or say borderline diabetic, क्योंकि वो regular test में आता है, and still don't know what to do. कैसे control करें, या things that you would want to tell.
So I think this is where the problem lies. Take professional help.
Yeah.
In today's time, you have good nutritionists, you have people in the gymnasium who are willing to help you, people are there to help you with your diet. So if you're just borderline, try not to cross the line and reach a side where you.
Yeah.
All right. All right, रेडियो सिटी पर ऑफ कोर्स मैं हूँ दिव्या एंड वी बीन टॉकिंग अबाउट ओबेसिटी क्योंकि मुझे ऐसा लगता है कि कुछ चीज़ों के बारे में अवेयरनेस बहुत ज़रूरी है और अगर आप चीज़ों के बारे में अवेयर रहोगे ना तो शायद आपको फिर इधर उधर भागने की ज़रूरत नहीं पड़ेगी. यू विल नो व्हेन टू सी एन एक्सपर्ट. सो वेरी हैप्पी मेरे साथ जुड़ रही हैं डॉक्टर वंदना सोनी फ्रॉम द मैक्स हॉस्पिटल साकेत राइट हियर, सीनियर डॉक्टर. एंड मैम यू नो आपसे अभी जब इतनी सारी बातें करी थी ना मुझे लगा था कैमरा पहले ही ऑन हो जाना चाहिए बिकॉज देयर इज सो मच दैट वी हैव डिस्कस्ड ऑलरेडी. But once again, for the record, like we were talking, ma'am, obesity is not just a lifestyle problem, but I think it's just the beginning because it brings in so many other issues now.
Yeah.
Why is it on a rise in last few years? Like we hear so much about obesity suddenly.
Obesity is, like you said, it's a lifestyle disorder. All right, and primarily in India, we were a hard-working community. All right, overall, our lifestyle initially was more of physical labor. Now, with growing affluence and westernization, and there is multifactorial. The women have stepped out of the house. They started working also, of course, and why shouldn't they? So as a result, it's a combination of these factors. There are more desk jobs involved. Because of the affluence, we have so many, the technology has provided us with so many amenities. Like you don't require, nobody is using a cycle, everybody takes a car. Even if somebody has to go to a gym, they will take a car. If the gym is on a higher floor, you will take the lift.
Yes.
Isn't it? So all those are the things which are combining to make us more and more and more sedentary. That is one thing. Secondly, our diet. Earlier, food used to be cooked. We used to have fresh food, cooked food. And today, if you, there's a huge movement in, which is promoting that you go back to cooking and eating freshly cooked food. So we actually moved over to fast foods, packaged foods, because both partners working or youngsters stepping out of their house, living in PG accommodations and working long hours, nobody has the time to cook. So eating more of packaged foods and all. As a result, what? Packaged food and all nutritional value goes down. It's filling your tummy. Carbohydrates are the one ingredients in all these packaged foods which don't get destroyed.
Yes.
Protein is the first thing that gets destroyed. Most of these packaged foods will not have nutrients like your trace elements and multivitamins and all. So what happens then?
Yeah.
You just gain weight. And fat. And even if you don't gain that weight, overall the nourishment which is required to retain your muscle mass, to retain the strength in your bones, you're not getting it from that food.
Right, absolutely.
Okay, so even if you don't gain weight, overall your body composition is not healthy. And that is why, because of a combination of all these factors, the chances of developing resistance to insulin. Insulin resistance, you understand what insulin resistance is? So it is basically that your body is producing sufficient insulin. Insulin is the hormone which normalizes or metabolizes the glucose metabolism in our body. So the amount being secreted is enough, normal, but it is not functioning anymore. It's not functioning anymore. So our cells are resistant to that insulin, and because of that, the incidence of diabetes is rising. And of course, other than that, with obesity comes so many other diseases, it affects nearly every body system. Diabetes is the commonest, then it's your heart, your lungs, your kidneys. The incidence of liver. Do you know there was a time when we were students that the commonest cause of liver cirrhosis or destruction of the liver was either alcohol. Alcohol was number one, and second was if you got infected with hepatitis B. Now the number one cause today is a fatty liver because of obesity. Okay, so that it is called metabolically active, it's a metabolic liver disease. MASLD is the name, I can't recollect the full form. So that is the reason, and the incidence of liver transplants being required in these patients is also the highest in patients who have developed MASLD secondary to obesity. It's amazing.
It's amazing, and ma'am, because you mentioned it recently, somebody said कि मेरा fatty liver आया और मैं तो पीता भी नहीं हूँ, and now I can now actually put it together that क्योंकि obese हो गया है, so because he's gained weight unnaturally for the last 6-7 months suddenly, it's also led to fatty liver. So वो एक चीज से दूसरी कितनी चीजें निकल सकती है. Diabetes we've spoken about, and ma'am, like we were talking, things that also come complementary with obesity. क्या क्या इश्यूज हैं जो आ सकते हैं?
मैं अच्छा एक और चीज़, I'll just bring your notice to that. Do you realize the number of infertility clinics?
Yes, they've
all
gone
over
up.
the country. Did you ever hear about it when we were young? No. Why? Because the incidence of infertility, lifestyle से एक तो chance भी नहीं मिलता. Number one, है ना? Secondly, the incidence of PCOD is very high. That is polycystic ovarian disease. Now, this is a problem which arises again. It is a metabolic problem secondary to obesity. In fact, we don't know whether obesity causes that or that causes obesity, but that is one of the reasons, and that is also dependent upon the sort of food we eat. In fact, they say that the way the milk is preserved and distributed in the country, there's one of the reasons, the sort of hormones which are fed or injected into the cattle for increasing the production of milk may also be responsible for that. Even the type of sanitary pads which are using, they release dioxins, is a compound which is released by some of the material which is used in that. That itself is known to cause. So it's multifactorial. There are a lot of gynecological problems are caused because of all these lifestyle disorders, and we call it progress because it provides immense comfort and ease in certain areas, but will always be a fallout.
Right. And ma'am, when I'm talking to you about it, it's like एक ना एक हमारे लिए, like say for a common man, ये जब तक हमारे को हिट नहीं करता ना एक पॉइंट पे, हम रियलाइज नहीं करते कि कितना क्रिटिकल हो सकता है. लाइक एवरी टाइम वी ईट जंक वी लाइक एक दिन और सही, आज लास्ट सही, वो कब तक चलता है, एंड व्हेन डू वी हिट दैट रेड फ्लैग इन टर्म्स ऑफ हेल्थ?
We don't come to know that.
We don't come to know
very
it.
True. Very
Ma'am,
true.
we talk to women particularly, bariatric surgery, and so many people that you deal with, obesity और cases के साथ, things that women should take care of in their 30s or say early 40s, and bariatric से अगर डर लगता है या सोचते हैं कहीं रिस्की तो नहीं, अगर हम उनसे बात कर सकें.
Bariatric surgery is one treatment option for obesity. It is not for everyone. And bariatric surgery is also metabolic surgery. So it is being performed also for diabetics as well as obese. Not all diabetics and not all obese. To decide who are the patients or who are the candidates, we have to grade the disease.
Right.
And obesity, when it becomes morbid obesity, then of course bariatric surgery is probably the best known treatment option even now. Bottom line, understand, obesity curable nahi hai. It is not curable. This treatment option is provided to those who are struggling to otherwise not being able to manage their disease. The surgery provides them with a tool with which they can control the disease. Number one. So, morbid obesity, to define that, we calculate their body mass index, which is a ratio of their weight in kgs to the square of their height in meters or centimeters, whatever. So, anybody who has a BMI of more than 35 with associated comorbid conditions or more than 37.5, they become candidates for bariatric surgery. There are various bariatric surgical options available. The one against which most of the others are pitted is the gastric bypass. The gastric bypass is still considered the gold standard. It's the longest standing procedure which has given or provided relief to a lot of patients. It's more than, it's now almost running 75 years. So it's a well-established procedure. There are other good procedures also, but किसी के really long-term रिजल्ट्स हमारे पास नहीं है, और कुछ ऐसे भी हैं जो जिनमें लॉन्ग टर्म में इतना फ़ायदा और रादर डिजीज़ के रिलैप्स होने का चांस ज़्यादा होता है. So this is something that the patient can actually discuss in detail with the treating doctor. Remember again, I am again reiterating कि ये disease curable नहीं है, ये इसको सिर्फ control किया जा सकता है.
Yes.
तो ये ऐसा नहीं है जैसे आपको gallstones हुए, आपने जाके surgery करवाई, आपके निकल गया, and then you live a happy life. You don't have to keep going back to your doctor. But obesity में long term में if you want to manage the disease and you have to want to enjoy a good quality of life, then it is imperative that you follow up and stay connected, be a part of the support group. Patients, हमारे patients जो हमारे support group में जुड़े हुए रहते हैं, we now have patients who are almost 24 years with us and who are doing very well. It is a pleasure actually to have these patients enjoying a good quality of life. Secondly, ऐसा नहीं है कि आपने surgery करवा ली, आप diet follow कर रहे हो and everything is fine. You have to take your supplements, and if you really want to have a good quality of life, enjoy a good healthy life, फिर आपको lifestyle में वो वाली changes लाने पड़ेंगे, which include regular physical exercise. You have to have your physical exercise. और ये मैं especially women के लिए बोलूँगी that as you age, you have the surgery also. As you age, even for a normal woman, once she starts hitting menopause, her hormone levels alter completely, and that is the time which is a time of rapid aging. You don't want that to happen, because for whatever time period one wants to live, one wants to enjoy a good healthy life.
Yep.
To enjoy that good healthy life, it is important that you have a good physical exercise, regular exercise. You need to retain that muscle mass. You need to be physically active. Your joints need to be well oiled and well functional. वो सिर्फ surgery, diet से नहीं होते. Exercise is a must. It is a must, and they do well.
I think over so many years, every time I've spoken to a doctor, बार बार एक चीज़ बोली जाती है, सही खाओ और सही एक्सरसाइज करो, ये चीज़ें फॉलो करोगे, मे बी द चांसेस ऑफ एक्चुअली सीइंग अ डॉक्टर थोड़ा या तो लाइफ में डिले होगा या शायद ना भी हो. बट हम लोग ये भूल क्यों जाते हैं? आई स्टिल डोंट अंडरस्टैंड. मैम, वन फ्यू टिप्स फॉर एवरीवन, लाइक यू गिवन दिस, बट एक चीज़ बिफोर एवरीथिंग एल्स, मैंने हर डॉक्टर से हमेशा जानना चाहिए, यू ऑलवेज हैव दोस केस स्टडीज दैट आर वेरी क्लोज टू यू, सम सर्जरीज और सम पेशेंट्स जो आपको याद रह जाते हैं. विद बेरियाट्रिक यू जस्ट चेंज देयर लाइफ ऑल टुगेदर, यू गिव देम अ न्यू लाइफ ऑल टुगेदर. कुछ आपके खास मोमेंट्स हैं व्हिच यू लाइक सिट ऑन डेज एंड यू आर लाइक दिस वाज गुड?
Well, yes, of course. ऐसे बहुत सारे हैं. There is one girl, Ashia. She's not in India anymore. Actually, she shifted to Canada. She still stays in touch with me. Got married, has a child now, and she's one of those patients, who reached a normal BMI. It's such a pleasure always to connect with her, and always on New Year's, on Diwali and all, on my birthday, she will wish me.
How sweet.
So those are very special bonds you form with your patients.
I think, ma'am, but मैं मानती भी हूँ, एक डॉक्टर पेशेंट का रिलेशनशिप इज ऑल्सो एज स्पेशल बिकॉज इट्स ऑल्सो लाइक इट्स अ लाइफ लॉन्ग रिलेशनशिप एट द एंड ऑफ द डे. वो रह जाता है लाइफ.
हाँ, इस डिजीज में तो इट इज़ सेफेस्ट फॉर द पेशेंट टू स्टे कनेक्टेड. एंड जैसे बहुत सारे ऐसी बीमारियाँ जो स्पेशली जो क्रॉनिक डिजीज़ है, जैसे डायबिटीज़, जो डायबिटिक होता है ना, उससे ज़्यादा अपनी उसकी बीमारी के बारे में कोई नहीं जानता. ही प्रोबेबली नोज दैट डिजीज़ almost as well as his endocrinologist. Similarly, is disease ko bhi you have to understand it.
Yeah.
You need to know it, and you will do well.
Ma'am, my final question to you is, when does a person know कि मेरी जो भी obesity है या जो मेरी condition है, it's alarming and I now need to see a doctor?
How do you tell that, you mean?
Yeah, I mean, how do I know that, okay, मेरे को अभी time है, I should see a doctor? Like there are a lot of people who are gaining weight.
ये तो it is so difficult to make a person realize that, because our mind fools us. And this disease is not something which comes overnight. It doesn't hit you like that.
Yeah.
It is so cryptogenic. Cryptogenic means
Yeah.
धीरे over the years. Now, so many people will come. I was always a little plump. मगर फिर मेरी शादी हुई, मेरी बच्चा हुआ, उसमें मैंने 25 kg lose किया. I was able to lose 5-7, but the other remained. और फिर धीरे. And then because it is such a gradual gain, your lifestyle, you keep adapting to it. कब आप बच्चे के साथ नीचे बैठना बंद कर देते हो या उसके साथ क्रॉल करना या उसके पीछे भागना बंद कर देते हो, वो कब पॉइंट था आपको पता ही नहीं चलता. सो द कॉम्प्रोमाइज ऑन योर क्वालिटी ऑफ लाइफ इज सो ग्रेजुअल that you really don't come to know. But for the youngsters, I will say that, you at your age or whenever you have a child, you should be able to actively participate in that child's life in every way if you are otherwise not handicapped. But if your weight is compromising your activities, that you cannot be part and parcel of your child growing up, in whether it's the park or the swings or whatever, then it is time to take heed. Then it is worthwhile to go and ask for help.
Thank you, Dr. Vandana, Soni. I mean, बड़ी बेसिक चीज़ें हैं गाइज. आपको शायद कोई बहुत बड़ा वो जैसे कहते हैं ना रिलेशनशिप रेड फ्लैग शायद सेहत नहीं देती, वो आपको छोटे छोटे साइन हर रोज़ दे रही होती है. एंड यू शुड नो कि कल मैं ये कर पा रही थी और मैं आज ये नहीं कर पा रही. मे बी इट्स टाइम टू सी अ डॉक्टर. मैम, थैंक यू सो मच फॉर टॉकिंग टू अस.
It was such a pleasure talking to you, Divya. Thank you.
Thank you, ma'am. Okay. Thank you for watching this. Thank you. Thank you, guys.